views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm Dr. William Latimer, your host. I am so pleased and excited to have Dr. Melissa Fuster as our guest today, Associate Professor in Public Health Nutrition at Tulane University. Welcome, Melissa.
Hi, thank you for having me.
So we're going to talk about something that is, I just think, wonderful and exciting. As a fellow academic, having written papers and know how hard it is to get things done, you are going to soon be releasing a wonderful book entitled Caribeños at the Table: How Migration, Health, and Race Intersect in New York City. It is published by an absolutely fabulous press, UNC, University of North Carolina Press. That's also fabulous. And I want to read just a little excerpt about the book to set the table and then turn it over to you. In the book, Dr. Fuster thinks expansively about the multiple meanings of comida, food, from something as simple as a meal to something as complex as one's identity. She listens intently to the voices of New York City residents with Cuban, Dominican, and Puerto Rican backgrounds, as well as those to the nutritionists and health professionals who serve them. She argues with sensitivity that the migrants' health depends not only on food culture, but also on important structural factors that underlie their access to food, employment, and high-quality healthcare. Boy, I can't wait to read this book once it comes out. Melissa, set the table for us. What led you to write this book, and what are some of the key points you're trying to make?
Yes, I think I should start by saying that typically in my discipline in public health nutrition, we do tend to tell the research in articles. So it's a lot of manuscript writing where you really don't have a lot of space to set the context for your research. So with the book, I thought this is a great opportunity to really set the stage, tell the stories of the people that I spoke with, and not only just, provide numbers or quotes here and there, but to really, contextualize not only what the people said, but also the histories of where the people come from and the community. The book itself, it's, as a first book, I should also say it's also a very personal story. I was born and raised in Puerto Rico. And so it is about my community and about the community in New York City. And the book came, I should also say, as a frustration, if I'm being honest, about how my discipline, public health nutrition, practitioners, how we deal with those persisting health inequities that we see. For example, in New York City, the Puerto Rican and Dominican community show very, very pressing diet-related health disparities. We are typically number one in terms of diabetes, obesity, And the problem is that we keep trying to tackle these issues with individually based approaches. And when we tackle immigrant communities or ethnic communities, in the case of the Caribeños, I also see that there is this overemphasis on culture, on cultural food patterns and how we can keep the culture, but at the same time blaming traditional cultural food patterns for these existing inequities. So with the book, what I'm really hoping to do is to shift the persisting focus on culture and just culture and bring to light the important aspects of migration, racialization, how we're treated when we move to the U.S., income, gender, class, and just make the story as complicated as it actually is.
Sure, and forgive me if I'm correct me if I'm wrong. Is that not also part of what the structural factors are in terms of your making the point? Culture is critically important, but there's so much more to it, and perhaps it's something to do with access to healthy foods and how healthy foods versus foods full of sugar are perhaps disproportionately marketed in urban areas. So what's the structural piece, really, is my question.
Yeah, so that's definitely a big part of this. And that's so many conversations we can have about how food companies do tend to market to minority communities, how people don't have economic access, sometimes physical access to the foods that as health professionals we want them to eat. In the book, I do, of course, talk about the food environment in communities in New York City, but I also seek to contextualize the community beyond the present and try to set the stage as to the history of these communities. So I dabble in I'm not a historian, but I did dabble in history and looked at the migration of the community, especially Puerto Ricans and Cubans. We have a long history here in New York City, more than 100 years since people from the Caribbean started moving here. Even Dominicans too. I believe the first mulatto immigrant was actually a Dominican descent. And these stories are often lost because, again, New York City is such a multicultural city that we are blended with so many other different communities. But at the same time, the way my community is perceived, unfortunately, is influenced by that history. We see, for example, in the 1930s, where there was the Puerto Rican problem, the idea that Puerto Ricans were coming into New York City in such high numbers, bringing poverty and so many things in such a sad way. Sometimes, as I was doing the research, that I found my community was being spoken about. And even though we do have professionals, people in high ranks in the city and in many other places, I believe there's still a stigma around how we are viewed in the community. So I did wanted to bring that history in just to contextualize the environment in which we come in the racialization as we move from the Caribbean into a context like the U.S., where people are categorized as Black or white in a very different way, where in the Caribbean there's different areas of color, and that does change a lot how we are viewed and discriminated against sometimes here.
You've just tackled some very macro to micro issues that influence how culture is perceived, and always and oftentimes not accurately. And I think, how do we change that? Even if it's contributing what we can within the communities in which we live and or work. And I don't think that's an easy question. And quite frankly, I don't think we talk about it enough because it is so difficult. And I'd like to get your thoughts on how we might work to change that.
It is a very difficult question. I think one of the ways that we can do it, and I mean, we also have to define who's the we in terms of from my perspective as a member of the community, I always try to just bring my perspective and try to challenge some of the stereotypes. For example, I teach future nutrition professionals, and I use my background as a way to tackle the stereotypes that they might have, to show how, yes, I am a Puerto Rican, but not necessarily I eat rice and beans every day, or I didn't, it's just, again, tackling those stereotypes as much as you can. And then on the other hand, I feel it's just important to remember that we can learn from others and learn about their history. And again, I think that's something that I hope the book will do, just again showcasing the complexity of the community, the history, and just to get some empathy. That even though I do focus on Caribeños on the book, I hope that it allows a new lens to look at all diverse communities that we have, not only in New York City, but other places too.
Sure. And that's great. I mean, so what I hear you saying, Melissa, is that part of the solution is how we educate future health professionals, nutritionists particularly, and how individual stories can be a part of that education to expand the narrative, challenge stereotypes, and so on. I think that's so important. So I've just asked you what I think is a really difficult question. Now I'm going to ask you another, what I think is a really difficult question. So you've already beaten the record of the number of difficult questions asked of a guest. So you mentioned a widely known fact that in the Bronx, there are very high rates of obesity and diabetes, and that's a major problem. And I've been in a lot of meetings where there's debate about the individual versus the population. And it seemed to me that you were a little bit more focused, and I'll tip my hat and say I like this, to the population and the structural factors. So, here's the hard question. How do we stem the tide? How do we substantively lower rates of diabetes and obesity in urban settings? How do we do that?
That's a big question. I think one of the ways that I feel thinking about interventions that we can do in the community is, yes, we can definitely do nutrition education, and there is a lot of money being spent in nutrition education, but we have to do more. And part of it is tackling why people may not eat as healthy as we want them to eat. And it is beyond education. It's also about access. And it's not just bringing the food to the community, but we also have to talk about basic things like the minimum wage, having access to good education, ways that people can rise up the ladder and improve their economic opportunities. And with all of that, you will have better nutrition, not just through access, but also through changes in education, exposure to different foods, things like that. So I think that is a major way, and also just tackling also the bigger issues of the food system, but that is another much bigger ask.
I love that answer, and it just demonstrates it's not just about food access. It's not just about education in the sense of health education. It's about providing access to higher education and education to folks so that they can have a profession instead of a job, and that's going to influence things like access to food and healthy eating. We're going to take a quick break. When we return, Dr. Fuster is going to talk to us more about her background and her own educational training, as we always do with our guests in terms of our second segment. We'll be right back with more on Public Health America. Welcome back to Public Health America. I'm your host, Dr. William Latimer. We're here with Dr. Melissa Fuster, Associate Professor of Public Health Nutrition at Tulane University and author of new book, Caribeños at the Table, How Migration, Health, and Race Intersect in New York City from UNC Press. Melissa, we just had a wonderful talk about your book and about your work and sort of the real complexities between food and eating behavior and culture. In this segment, as you know, with all of our guests, we talk a little bit about their history, their family history, their educational history, and sort of what enabled these super smart people that I get to interview sort of made it to professional careers that ostensibly they love as opposed to just having a job. So to set this table, let us know a little bit about your formative years, where you were born.
Yeah, I was born and raised in San Juan, Puerto Rico. And so I did my most of my education there. I did start my undergraduate degree at the University of Puerto Rico. I started studying biology because I just really like science. If I'm being honest, back then I didn't have a set clue about what I wanted to do when I grew up. But then as I continued with my undergraduate education in Puerto Rico, I also became curious about the possibility of leaving the island, even if for a little while I thought back then. And I decided to explore the possibility and ended up transferring to Florida International University in Miami. And that was of course one of the first times I left home. I think in Puerto Rico it's different than in the US, where people do tend to stay home while you're studying, and then it's not only after that you leave, where I feel here in the US, the kids tend to leave home very early on. So when I left, it was of course challenging being on my own without my family, but it was also a very good experience, and it allowed me to see a lot of possibilities in terms of my career. Back then in Puerto Rico, as I was again trying to figure out what to do, that's always a very challenging thing as you are graduating from high school. Honestly, again, I had no idea, and in Puerto Rico, it seems that you had like few opportunities or good career paths, like doctor, lawyer, engineer, like those set professions. The idea of becoming a professor even or doing research was not something that I had really in my mind. So it wasn't until I left and went to Miami, to Florida International, that I realized, wait a second, I can actually do research, do all this creative work and get paid for it, like make a living out of it. So that transition was, I think, something that really opened my eyes to a lot of possibilities.
That is such a great story and such an important transition, in my opinion, because having mentored quite a few students in my lifetime that were first generation, I don't know if you were first generation, but anyway, first generation college students that, like you, didn't necessarily see themselves in that role. I'm not sure I did either. What led to that epiphany? In other words, you were at FIU, you had been at University of Puerto Rico, another outstanding institution that I actually know quite well. Was it a mentor that said you can do this? Was it being surrounded by doctoral level students that just you took it in by osmosis? Like, is there a way you can define what led you to realize that you could chart that path?
I think it was mostly being exposed to professors that were doing research, and just even when you're a student, you don't have a lot of money, you have to work. So I also had a chance to be involved as a research assistant in different studies, and that really opened up the possibility of doing research, of again a lot of other things that I really wasn't thinking about back in Puerto Rico.
Right. So what I take away from that I think is so important, and it sounds easy, but it's not. And that is this: you were surrounded by faculty who did research. That's one, and another, you had practical learning experiences in the form of research assistantships where you were engaged in research. I will just throw this out to you. I don't know if this is a problem you face, but I know of many students at Mercy College, at other colleges I've been at, that, they're working 2 or 3 jobs while they're going to college. And then somebody like me says, well, why don't you volunteer or get paid $12 an hour to be a research assistant? And their response to me is, I'm working 3 jobs so I can go to college. Was that a tension that you faced, or was the research assistantship enough to sort of make ends meet, or how did it work for you?
That is a great question, and I've also had a similar experience now as a professor with students, where I do my best to be able to pay them for their work, even though sometimes they do want to volunteer because of the opportunity. I will say that I was lucky that my mom supported me throughout my undergraduate education. I mean, I also, of course, I do have student loans, like I think a lot of people here, and through the loans and through some of the support from my mother, and also with these part-time jobs, I was able to do it. So it was, I did have to work, but it wasn't thankfully that, like exactly what you're mentioning, those experiences that I know students like that are juggling a lot of jobs at the same time.
Fair enough. And so from FIU, where did you go from there?
So after I completed my undergraduate, and I will say also that transition led me to change from biology to social sciences, which I was really interested in back in Puerto Rico, but didn't see that career path that clear. So as soon as I became more interested in research, also sciences became a possibility for me. And I ended up staying at FIU working as a research coordinator for about a year while I figured out the next step. And
Yep.
This is when I started to realize my interest in food and discovered the graduate program at Tufts University in food policy. So then from Miami, I jumped up to Boston, and that was the change, the true change for me, going up to the Northeast. Yes.
And Melissa, you say something that I just think is so important. I've worked with so many students at different places where, and I understand this, and it's a pragmatism that I respect, where they want to get done and they want to get a job. And I'm not contesting that, but there have been, it has not been infrequent that I have said, take that extra year if you can. And in your case, that was a year at FIU where you again continued as a research assistant, and that year provided you with the time to think through what your next step would be. Now, you were fortunate, you had support from your mom, you were working hard yourself, etc. But it's that time that enabled you to sort of figure it out and then make your way to Tufts, another wonderful school. At Tufts, did you go right into a PhD, or what was the degree you worked on there?
No, I did my master's degree, and I will say that in between, I did, it was a full-time job, so I was already independently supporting myself back then, and yeah, I agree definitely, and something I also tell my students that if possible, you need to take some time in between, unless you're 100% sure you know what you want to do. It really wasn't my case, so I did take time between my undergraduate work 1 year, did my master's at Tufts, worked for a little bit more than a year in public health research, and then went on to my PhD. Once I knew it, I was really sure what I wanted to do.
And where'd you do your PhD?
I actually went back to Tufts and did the PhD in food policy and applied nutrition.
Great. So you did your master's, you took another year or two for a little bit more work. you knew then what you really wanted to do, and then went back to Tufts to complete your doctorate.
Yes.
Great. If you, I mean, this is your journey and your path, I think, is so emblematic of, and I'm sure it might not feel that way when you're in it, but like you did a lot of things right, in my opinion, in terms of your progression, the time you took, the decisions you made, the experiences you had while still working a job, et cetera, et cetera. If you were giving guidance, well, you give guidance, you mentor students now. If you were giving guidance to high school students, say in the Bronx or NYC, about what they might be doing to sort of position themselves for their next step in the journey, in the sense of four-year college, maybe they're concerned about being the first in their families to attend college. Maybe there are financial issues. Maybe they're not 100% sure it's the place for them. What is some guidance you would give them?
That is a very good question. And I will say, the value of college, it is so valuable. You do have to do something after high school. And this is the time where you really solidify your learning, and it will help you a lot in your future professional development. I will say that even though it is intimidating, and I was lucky that I wasn't first generation going into college. I was the first in my family to do the PhD, but I do have a lot of professional women, I should say, that I had a good examples of hard work and studying and just pushing for education in my family. But you shouldn't stop at that progression in your career because you are intimidated or afraid or you feel you will fail. I recommend you need to give it a try. And also for students, I know professors can seem intimidating, but it's also, programs like this hopefully will make us more human and more approachable. And even though they might find people that might not be lenient or they feel they don't understand their problems, there will be others that will be there to help, because as professors, I know I'm speaking for myself and all of my colleagues that I had, we do want students to do well and graduate and just be good professionals. So it is very important that students, especially as you're beginning, don't be shy, reach out to your professors. This is part of our job to make you progress and do better. So if you're feeling lost, if you don't know what you're doing, it's always great. Just reach out, ask questions, send emails. The worst that can happen is that people don't respond. So
Wonderful.
don't be intimidated by that.
Life lessons for certain. I am so grateful and thankful to you, Melissa, Dr. Fuster. Make sure to pick up her book, Caribeños at the Table, How Migration, Health, and Race Intersect, in New York City on the UNC Press. It has been such a pleasure. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer, and we'll see you next time on Public Health America.